Good afternoon, everyone. Thank you for joining us today. I'm Jamie Parrott, Vice President and Chief Operating Officer for MedResults Network. And again, we're thrilled to have you here today. We've got an exciting presentation. For those of you who've been following us for the last 2 weeks, you've probably seen some exciting announcements from MedResults. And the one I'm speaking of specifically is that we expanded our relationship with Suneva Medical. So we've invited Suneva here today to talk a little bit more about that partnership and what you guys have access to now moving forward. For those of you who have been members for quite some time, you're probably aware that we've offered Belafil, which is one of Suneva Medical's products. They've expanded their portfolio to, I believe, 8 new technologies. And now you guys have access to 2 more, which include a plasma energy-based technology, as well as, and that's PlasmaIQ, and SteriGlow, which is a microinfusion technology. So we're not going to talk about SteriGlow today, but we are going to be talking about PlasmaIQ and both the clinical aspects and business aspects of adding a plasma energy-based device to your practice and what that could mean for potential practice growth. So without going on and on about that, I'd love to introduce our speakers today. We are fortunate enough to have Pat Altavilla. She is the Chief Executive Officer of Suneva Medical, and she started nearly 5 years ago as Vice President of Sales and Marketing with Suneva, and she's been in the industry for over 30 years in medical anesthetics, and she previously served as the Vice President of International Sales and Worldwide Marketing for Mentor Corporation. Pat's also held executive and leadership roles with a number of different companies, such as the Plastic Surgery Company, Bioform Medical, and Zeltique, just to name a few. And she also co-founded and ran Spa Medicus Skin Enhancement for several years. So she is certainly an expert in the aesthetic medical arena. We are grateful to have her here today. She's going to join us a little later in the presentation. Thank you, Pat. Our second speaker, actually, he's our first speaker of the day, is Dr. Brian Pilcher. And Brian brings over 18 years of experience in dermatology and aesthetics, and more recently as the principal of Critical Mass Scientific Strategy Consultants. He's also served as the Vice President of Medical Affairs for MERS North America, the Vice President of Medical Affairs and Clinical Education for Bioform Medical, and Director of Research and Development for Cutanix Corporation. And a few more facts about Dr. Pilcher's elaborate career. He also led a team of 40 nurses and physician assistant educators and was the assistant professor at University of Texas Southwestern Medical Center, where his research focus was on cellular and molecular mechanisms of wound repair. So again, we're delighted to welcome Dr. Pilcher with us here today. And before we get started, just to bring your attention to your screens, this is a new platform for many of you. During the presentation, I will probably put up a link or two. So if you'd like more information on PlasmaIQ, you can just click the button to learn more. It'll take you directly to the PlasmaIQ site to get that information you're seeking. And without further ado, I'll turn it over to Dr. Brian Pilcher to start us off. Brian, I believe you might be muted here.
See, I was trying to make sure that I didn't make any noises, but I started to talk and you couldn't hear me. So what I'm going to do with you guys today is take you through some of the basic science and clinical pieces as it relates to PlasmaIQ. Plasma technology actually is not really a new technology at all. There are a number of companies who have FDA clearance and approvals for use of plasma as an ablative device for skin tightening and remodeling. But those devices historically have been in the big box format. So you're talking about a device that is going to cost over $100,000, take up a lot of space in your practice, and not be easily transferable from treatment room to treatment room. What has happened over the past year or so has been really an explosion of handheld plasma delivery. And it's going to be important for you to understand that you want to make sure that you're using a device that is approved and cleared by the FDA. I'll certainly go through that in just a moment. And so what I'm going to do in the first initial set of slides is really to talk about the basics of what plasma is. Now, The best thing that I can do to get you to understand what plasma is, because you really typically don't think about it. If you remember your basic science classes, you think about the states of matter as being a solid, a liquid, or a gas, right? We all know what those are. Plasma is the fourth state of matter, and it is, if you can look at how we have this shown to you on this slide here, from low energy temperature to high energy temperature, it is the highest energy temperature of anything that you can deliver. And so it makes sense that this would be something that would perhaps be used in skin biology or in aesthetics as a way to tighten and remodel the skin. The easiest way to think about it is if you've been to your local science museum, this little machine here where you can place your hands on it and it sort of is attracted to you. That is essentially plasma. And all it is a form of matter that consists of both positive and free electrons. It's the most abundant type of matter in the universe, even though we really don't think about it from a day-to-day basis. But the way in which you are able to create plasma energy is you need some form of a gas source. In the case of PlasmaIQ, that is the atmospheric nitrogen that is present all around us. And if you use electromagnetic energy to excite those electrons that are in nitrogen, it can then become essentially an ablative type of technology. So any gas can be used to create plasma, but in the case of PlasmaIQ, and also in a number of other devices, they're using atmospheric nitrogen. So as I said, we're using atmospheric nitrogen to ionize that gas with an electrical current. And that basically then that energy is transferred over to the skin to cause an ablative type of wound. This is another thing that you want to be understanding, is that this is on the order of the type of energy that you're delivering, such as with a CO2 laser or an erbium laser. So this is a true ablative technology, and I'll show you some histology in just a moment to prove that. What's also interesting about this particular technology is you're not applying the tip or the electrode directly to the skin. It's about 1 millimeter away from the skin. There's an energy arc that goes across it, and you can kind of see it here. If you can see my arrow, you can see that light at the tip of the electrode here. That is the plasma energy that's being delivered. So it's a non-contact. The probe does not touch the skin. It's in close proximity. When you activate or actuate the device, it creates that energy. What is actually happening, and I'm going to show you the actual histology in just a moment, but essentially you're getting two types of wound healing or type of wounding. The first is you are ablating the outer epidermal layer, and depending upon the amount of energy and the amount of time that that energy is on the skin, you're going to have varying degrees of width and depth of ablation. So that's something that'll be very important when I talk to you about how to use the device in your actual practice. In addition, because of the thermal heat that is generated, you end up with a thermal zone of coagulation. And if you're used to or understanding many of the other types of laser technology that do heating, many of you are probably very familiar with Ulthera or micro-focused ultrasound, as well as radio frequency delivery. Each of those types of energy results in a superheating in a very focal way in the dermis. And it's that heating that activates the fibroblasts and other cells within the dermis to remodel the collagen. You also have a natural unwinding of the collagen, and that sets into place what I would term, a basic thermal wound that will result in skin tightening because of the collagen unwinding and rewinding, as well as new collagen and elastin that are produced by those fibroblastic cells that have been activated due to the normal wound healing process. So with plasma energy, what you're seeing is an ablative type of wound where you're actually removing tissue. So that's actually an irreversible type of wound that will heal over with the body's normal healing processes. And then you have the reversible thermal wound that is created that jumpstarts that collagen production for your tightening. So just to orient you a bit as to some histology photos that I'll show you in a moment, the outer layer of skin is made up of epithelial cells that are termed the epidermis. In those areas where you're putting the plasma energy into the skin, these are the cells that are going to be ablated or removed. Secondarily, depending upon, as I said, the length of time that you apply the energy and the strength of the energy that you're applying, you're going to have an ablation of the dermis. And the histology shows that can be actually down into the reticular layer. So you can have a pretty significant area of ablation if you're not careful, and that'll become very important when I talk about the length of time that you want to apply this energy. And as I said earlier, you have the thermal necrosis or the ablation zone, as well as the thermal modification, which is the thermal zone of modification that I'll show you. It's very easy to see on histology. One thing that's interesting is, though, even though you're ablating the tissue, it's not blown out of the wound. You end up with a crusting effect that you'll see on the video that I'll show you in just a moment. That is the remnants of the epithelial cells as well as the dermis that have been ablated. It really provides a closed wounding type of effect. This will be important for you to understand as you're discussing with patients what to expect after the treatment, and I'll talk about that in just a moment. So this is some histology that I wanted to show you, and quite frankly, we're the only company from the handheld side of the plasma energy devices that have gone and looked at this from a histological perspective. Suneva really wants to lead with science. We want to make sure that what our products say they do, they actually do, and we want to back that up with studies that demonstrate that effect. So what you're looking at in this 4-panel histologic series is punch biopsies that have been taken after wounding in patients that either were undergoing an upper blepharoplasty or a facelift, and this was in the preauricular area of the skin, and they were treated prior to surgical excision with the PlasmaIQ device. And they were either treated at low power in the left-hand panels or at high power in the right-hand panels. The upper panels represent 1 second of energy delivery, and the lower panels represent 2 seconds of energy delivery. Now, what's important to understand, and I'll go into a little bit more detail about this, if you're familiar with, let's say, fractionated lasers or CO2 lasers, they have a highly coordinated and timed delivery of energy in the millisecond range. So it's a very rapid fire and very equal in each of its energy delivery. What's unique about handheld plasma devices in particular is that you, the provider, are responsible for the amount of time and the level of energy that goes into the wound process. What I mean by that is the amount of time that you're spending with the power arc or the arc of energy being delivered to the skin is dependent upon you having the probe close to the skin and the energy activated or actuated. So it's very important to understand that timing is quite important. And the reason why that it is, you can see here at 1 second at low power, we're getting ablation of principally the epithelial layer and not really too much deep into the papillary dermis. You will recognize here, though, a thermal zone of modification. This is the very, what I would call the darker and more even pinkish area. This is the melted collagen. You can see how that's different from below here, deeper in the reticular dermis where the collagen is much more normal appearing. So you do get a thermal zone of modification, but you get less of a area of ablation. And you can compare that on the other end of the spectrum, as you can see here, treating the skin with high power and over 2 seconds, a very deep wound that is due to the ablation of the epithelium as well as the dermis way down here into the reticular dermis, and you also get, in addition to that, the thermal zone of modification. Now, we believe that most of the effect of this device is really being done, or I would say the money area is in the thermal zone of modification. In all of the wounds that we've created and all of the wounds that we've assessed, there is really no difference between low and high power in this thermal zone of modification. The only differences that you see are in the depth of ablation. So it's important to understand that when I talk about, from a training perspective, how you utilize this device in practice, that you start all of your patients at low power and at 1 second. And we'll talk about why that's important in just a moment. So it's keep in mind, progressively greater length of plasma energy delivery and higher power setting are going to result in increased depth of wound. Why that's important is you may be, having an issue potentially in patients that are Fitzpatrick skin types 4, 5, and 6, or your darker skin types, and you also run the risk of some scarring. So you want to be very, very careful in the use of the higher power. That's really for patients who maybe did not get as significant a result on low power, and you want to try a little bit higher power. You may try it, at a half a second versus 1 second. But all of this is to say, respect the energy that's being delivered because it's actually real. We do offer training. I'm sure that that Pat and or Andy will talk about that in just a moment as it relates to what we offer you from a corporate perspective. I have a team of clinical educators that can come into your practice and actually do live patient demonstrations with you. But what we teach across the board for all of our providers is what we call the 1-1-1 rule, because it's very simple to understand. 1 second pulse duration at low power. You want your coagulation zones to be about 1 millimeter apart. That's your wounds that you're creating. And you really only want your tip of your electrode to be about 1 millimeter of distance from the skin to get that energy arc. So factors that are going to impact the depth of penetration, we've already talked about length of pulse duration. Number of passes, really 1 pass is going to be sufficient. You're not going to need to do multiple passes to get better results. Delivering the energy for longer periods of time may seem like a good idea to get a better result, and that is not necessarily the case, again, because of the risk that you run around scarring and potential hyper or hypopigmentation. We'll show you what the device looks like in just a moment. It does have a high and a low power, but we're pretty focused on making sure that you remain on that low power as you're getting comfortable with use of the device. And of course, thickness of the skin and patient's age. If you have somebody that's very, very old, very paper thin skin, you're obviously going to want to use a lower power on perhaps very quick passes or very quick delivery of energy as compared to somebody with very thick, glabrous skin. And so you're going to be able to modify it a little bit as it relates to that particular issue. So we've also looked at all of the energy-based devices that are available to you in practice. We want to give you some sense of where they fit amongst everything that's available. So starting from the left-hand side, you have your ablative technologies such as erbium or CO2 lasers, and then the non-ablative technologies, which are really delivering heat below the skin, such as IPL, alexandrite, diode, ND-YAG, and radio frequency. And then, of course, you have microneedling and radio frequency microneedling. But where PlasmaIQ sits, and this is different, again, based upon our histologic studies, it shows you that at low versus high power, you are getting down into the reticular dermis, which is even more aggressive than, say, a CO2 laser. So that's why it's very important for us to understand that that 1-1-1 rule be followed and be applied in your clinical practice to get the best results. All right, let's talk about using the device. This is what the device looks like. It's a very small handheld device. Sits in this very nice charging station. You can pull it, put it in your lab coat, walk around with it all day long. It keeps it charged throughout the day. This is in an exclusive marketing and distribution partnership that we have with Nuvia throughout North America. So we are the only distributors of PlasmaIQ in the United States. As you understand, it's a non-surgical solution for skin tightening and remodeling. I mentioned already, we do provide educational support through our hands-on training. That comes at no cost to you. You simply request it, and we work with you to schedule the best time to get into your practice to do those hands-on patient demonstrations. And then, of course, you're going to hear about all of the marketing types of activities that Suneva is going to also partner with you to make sure that once you have the device in your practice, that you are going to be successful with it. We are backing it by a 2-year warranty. This is what it looks like when it comes out of the box. Kind of looks like a little bit of an Apple box in a way. The way that it's packaged is very nicely packaged. What you basically get is the charging station, the PlasmaIQ device itself. There's a USB card that includes the user manual, which is essentially the instructions for use. You can also get this online, obviously. And then it comes with a set of electrodes. We'll talk about the electrodes in just a minute. What's packaged in the box, and we're now working on making up a mixture of straight versus angled electrodes. That is really up to you. I'll talk about in just a moment why one might be preferred over the other. You'll notice here that there is a high and a low power button. So again, high is going to deliver a much higher strength of energy compared to the low power, and we'll talk about that in a couple of slides. The next slide, in fact. So here again, it is sitting on the charging station. High power and low power. This light here will only become activated once you have the energy being active. So you are responsible solely for the delivery of the energy. I'll show you a video of what that looks like in just a moment. If you don't push the button, it's not going to deliver energy, and it will deliver energy as long as you have the button pushed and the probe close to the skin, about 1 millimeter away. We do know that our device will provide 650 volts of energy at the low power setting and 950 volts of energy at the high power setting. We are in the process now of looking at competitive products to determine how much difference there is from product to product. I think that's going to be important data for everyone to understand. Those are studies that are ongoing, so I don't have data to share with you today, but we are going to be looking at that. So as I said, there are two types of electrodes, what we call the straight electrode or the curved or bent electrode. Most individuals, in fact, I would say probably 90% of the treatments that are being done today are with the curved electrode because it allows you to hold the device in a specific way that is more ergonomically pleasing, meaning your hand is not going to get tired nearly as quickly, and you're going to be much more precise in your energy delivery with the curved or bent electrodes than the straight. That's not to say that some people don't prefer the straight over the curved electrode. I would say make your own assessments and judgments about how you want to hold the device and deliver the energy, and then that will become your electrode of choice. These are single-use, one-time only electrodes. They are not to be re-sterilized and used on subsequent patients. The way in which the electrode is inserted into the device is very, very easy. If you remember from any locking mechanism, lefty-loosey, righty-tighty, it's the same way. So you're going to be, putting the electrode in to make it to where you can put it in, and you just tighten it down. It's very simple and easy to do. The indications for use for PlasmaIQ, it does have its own very unique 510K number. So and I'll talk about this in just a moment as it relates to 510K clearance via the FDA. But the approval or indications for use for PlasmaIQ is to be used in the removal and destruction of skin lesions and the coagulation of tissue, that being targeted coagulation of epidermal tissue aimed at safely providing renewal for the delicate skin on the face and around the mouth, and also for removal of skin lesions. As I said, the user manual, you can find it on our website, as well as in the USB card that comes in the device. Where people are using this, again, pretty much any area on the face. I will make a note that the eyelids and the eye region currently is contraindicated, and this was in discussion with the FDA. We are actively engaged with the FDA to remove that contraindication because it is an area of interest from many providers, especially in those patients that perhaps have hooding in the eyes but aren't yet ready themselves to undergo a surgical procedure. This is something that has been done outside of Suneva, and perhaps you can have that conversation with your clinical educator when they come into your office to lead you through the training on the device. But other areas that it's going to be used, of course, lesions can be removed, but most importantly, it's usually being used in the perioral region to treat, smoker's lines, very fine lines and wrinkles around the eye, such as the crow's feet. These are areas where it really, really shines. Some of the contraindications, I'm not going to go through each one of these, but essentially, if you're familiar with any of the contraindications around ablative technology, they're pretty much the same as it relates to plasma energy. So if you're used to using an erbium or a CO2 laser, this is not going to be anything different. In fact, patient consultation ahead of time and patient consultation after time about what to do are typically very, very similar. So you do want to obviously consult with your patient because there are some things that could happen. You want to make sure, that they don't have uncontrolled epilepsy. These are all things that the FDA required us to put into our labeling. You want to make sure that they haven't had, let's say a chemical peel or any other procedures recently before they're sitting in your chair. You want to give them time to heal. And again, contact lens use is not recommended if indeed you're treating around the eye, but I will reinforce that that is a contraindication in our label currently. Some of the adverse events that you can potentially get: swelling and bruising, scabbing and crusting, because again, it's a ablative procedure. Hypo and hyperpigmentation have been reported, but again, this is typically in the 4, 5, and 6 skin types from the Fitzpatrick skin type. So it's important to make sure that you do a really good assessment of determining what that Fitzpatrick skin type is for that patient. Scarring has been seen in all plasma device use, just like it can be seen in any energy delivery device that's an ablative technology. And again, that's why it's important to start at the low power with 1 second setting. And then, of course, redness and tenderness. So really the take-home message is the more aggressive that you get with energy delivery, the more potential you have for adverse events. And so that's why we're very strong on the 1-1-1 type of idea. So what type of patient are you looking for? Well, you're looking for patients that have, perioral or other fine lines and wrinkles. They really don't want to do dermal fillers. And this is something that you really could upsell. Let's say that they're getting a dermal filler treatment that day, but yet you don't want to use maybe a lot of dermal filler that's really meant for superficial lines and wrinkles. You're treating them for volume correction. This is really easy upsell to patients to say, look, I can give you volume, but I can also give you some skin benefits as well. And that's what's nice about having the device and it being portable. As I say, you could carry it, in your lab coat, and that treatment can happen sort of ad hoc or, spur of the moment. The one thing it's interesting, or that they should probably understand, is depending upon this, and this really goes for any aesthetic treatment, quite frankly, is you may require more than one treatment to get the full benefit. That surely is the case with this device as well. Typically, we'll see either 2 or 3 treatments, depending upon the overall severity of whatever it is that you're treating. And you stage those, 4 to 6 weeks apart, giving the patient enough time to heal. As I mentioned, those skin crusts that develop from the ablative nature of the device, those will typically fall off naturally between 5 and 7 days. And we want to make sure that the patients are counseled not to scratch those off, but they're allowed to heal naturally over time. And I'll talk more about that in just a moment. So of course, we want to under-promise and over-deliver. That's the case with any treatment that we do in our aesthetic practice and any modality that you're using. I've already talked about the potential for retreatment. If you're doing just general skin tightening, you're probably going to see something pretty reasonable as far as an end result with one treatment. But if let's say you have a patient with very deep smoker's lines, that's going to take probably more than one treatment. So again, you're treating to the overall severity, and you're not over-treating at any individual treatment time. It's much better to, prevent any potential adverse event and stage them with 2 or 3 treatments. Of course, they have to understand this is not a facelift, and they shouldn't expect surgical outcomes, but the results do look good. And I'll show you some before and after pictures in just a moment. All right, so let's talk about treatment and techniques. You want to make sure that your patients, are avoiding sun exposure. They're not tanning about 2 to 4 weeks ahead of treatment. Again, this is not out of the ordinary for any type of laser or other type of ablative treatment that they would be getting. And again, they want to, be applying SPF as part of their normal skincare regimen about 2 to 4 weeks prior to their treatment. This is a painful procedure. I mean, you are ablating an area of skin in a fractionated manner, and so you want to make sure that you're using some form of topical anesthetic. Other physicians I know will actually locally infiltrate or provide, let's say, a lip block with lidocaine, if that's something that you typically do with your lip filler injections. It can be painful for the patient, and so you want to make sure that they're as comfortable as possible. The goal is to create multiple small, precise coagulation zones. And so if you look at the picture here, each one of these dots is a single point of energy delivery. You can see the probe here with its delivery of energy, and I'll show you a video of what this looks like in just a moment. So you need to have obviously good visualization for what you're doing. Some providers use loops, others do not. It's again up to you or how good your eyes are. I certainly would need glasses to do it because I need reading glasses. The other thing that I would say is there are many roads to Rome. A lot of other training organizations with plasma energy will say you need to absolutely do this box with dot, where you do a box and put a dot in the middle. Others will say zigzag, and others will say linear pattern. There is no right way to do it. All 3 of these work very, very well. What's essential, though, is that your coagulation zones are 1 millimeter apart. And so if you just remember that 1-1-1 rule, which is again, the probe being 1 millimeter away from the surface of the skin, the coagulation zones being 1 millimeter apart, and your energy delivery at low power for 1 second, then you're golden. For lines and so if you're doing lines and wrinkles versus tightening, the way in which you treat the skin is going to be slightly different. So if you have a very deep, let's say perioral or smoker's line, you want to make sure to treat along the edge of the line on either side of the wrinkle. You don't want to be into the depth of the wrinkle. Now that's different if you have a very superficial line and wrinkle. You can basically ablate over and it's not a problem. It really mainly is for the deeper smoker's lines where you want to be on either side. And I'll show you a picture of what that looks like in just a moment. Of course, the best tissue response is going to be shallow wrinkles and thinner skin. And so you, again, just remember that on either side of the deeper wrinkles, it's going to be better. and you're also probably going to have to do multiple treatments for the best result. For tightening, you're really covering an entire region with an evenly spaced pattern, much like you would any other delivery of energy. Post-treatment care is actually very, very simple. Whenever you have those carbon crusts that are formed from the ablation, you want to make sure and tell the patient to apply a thick moisturizer. It's really dependent upon whatever your practice uses. There are a number of topical products that you sell in your practice, I'm sure. The thicker, the better, and they're going to put that on and have it be for at least 12 hours before they do any kind of subsequent, cleansing of the skin, let's say. You want to make sure that over time, as they begin falling off, that the patient does not, scratch them to get that to hurry up. You want to make sure that that wound remains closed and heals, and that once it falls off, that's going to provide you with the best result. Of course, they don't want to pick or scratch at them. They want to avoid sunlight, excess heat, steam, all of that for 48 hours. But, at 2 days, you can quit using the very thick occlusive dressing, and then they can apply, an SPF 50 with a nice thick moisturizing effect. So don't use makeup, mascara, creams, or sunblock until those scabs have healed, usually about 1 week after time. All right, I'm going to spend some time talking just very briefly about the importance of 510K clearance. And the reason why this is important is there are a number of devices that are out on the market today that do not have FDA approval. So this is really a benefit that MRN has, made a really nice partnership with Suneva, because we are one of 2 companies that have 510K clearance for our handheld plasma devices. Suneva was the first one to get 510K clearance, and the one that came behind us was Cartessa. Cartessa has their own handheld device, and they actually used the PlasmaIQ device as their predicate to get their approval for theirs. So we were the first to get our 510K clearance. Cartessa is the only other company that has a clearance. But I will tell you, there are other companies that I would call rogue that are selling devices into the US market and claiming to have FDA approval, and they absolutely do not. Why that's important is that you must have 510K clearance to be ordered to legally sell or distribute Class 2 medical devices in the United States. And what that means is when you have a 510K clearance, it is specific to your device, and the FDA has determined, based upon the data that we have submitted to them, that the device is safe and effective for its indicated use. If you don't have 510K clearance, you don't have approval. It would be like buying a European dermal filler, for example, injecting it into your patients, and you certainly don't want to have that happen if the patient has an adverse event, because you're going to be totally on the hook as it relates to that. So I'm not sure if you're aware as to how medical devices are classified, but you have Class 1, Class 2, and Class 3 devices. We sit in the Class 2, which is basically a medium risk. So most 510K approvals or clearances in our space are for Class 2 devices. For example, I'm not sure if you're aware of it, but all of dermal fillers are actually Class 3. So this actually sits one level below dermal fillers. Class 3 devices, which are all of our dermal fillers, as I said, require a full-blown clinical study to gain approval, whereas Class 2, the 510K pathway is ideal because you can get to market much quicker, and it's usually based upon a predicate device that is very similar to. So we had to go into the FDA and prove to them that the PlasmaIQ device was similar to a predicate device, show them the safety data behind it, and once they were convinced that it was safe and effective, we got our 510K clearance. I'm going to just pop over to here. So there is 2 devices, as I said. There are a number of those that are selling them, without 510K clearance. So just be very, very careful if you are ever having conversations with people who have these other devices, because they should know, quite frankly, that they don't have that approval, and that's important. I won't spend more time on that because this is obviously the bad things that can happen. You can actually pick up a plasma pen device off of Amazon. There are many Chinese variants that aren't approved. So just be very, very appreciative of the level of energy that can be delivered with these. And I think that's why we're so focused on training and making sure that you're using the device at an appropriate level so none of this type of bad adverse event happens. These are not PlasmaIQ adverse events. So treatment with PlasmaIQ, this is where we're going to talk a little bit. I'm going to actually show you a quick video. It's just over a minute long. What you'll understand is once this video, let me see here. I think I'm going to be able to play it. Yes. So it's a very simple procedure. Here we go. So you can see the energy being delivered to the patient. This is treating smokers' lines. And again, the physician here that's delivering the energy, this is a very good example of what I would call the 1-1-1 technique. So you can appreciate that these are about 1 millimeter apart, that they're on the tissue for 1 second or less, really. This is utilizing low power. And you've got the probe about 1 millimeter away from the surface of the skin. So you're never actually touching the surface of the skin. You will begin to see over time with large surface areas a buildup of carbon crust. You can kind of see the blackening at the tip of the probe. You may need to, from time to time, wipe that off because you'll notice that your energy delivery just doesn't seem to be as effective. I will note that this is not a sped up video, so this physician is actually working quite quickly. And the amount of time that it takes to get this procedure from beginning to completion is, of course, dependent upon the type of anesthesia that you're delivering to the patient, and how quick you are, in addition to how large of a surface area are you going to treat. So, for example, for perioral rhytids, as we're seeing here, this treatment can be done in about 10 minutes after they've been numbed up. Other areas, again, depending upon the level of or the overall surface area. If you wanted to do, let's say, décolletage, that's a large surface area, and so it's going to take you a little bit longer. So you just need to build that in whenever you're doing that. So here's some before and after pictures. You can see these will be smokers' lines. Focus on the lines here in the preauricular region that have been treated. Again, not a fully effaced wrinkle, but you can see a dramatic benefit as it relates to skin tightening. These are some more lines around the perioral region. I think you can appreciate, even with one treatment and looking at 1 week after, so you can see some remnants here of the coagulation zones. But again, looking at this patient here at 4 weeks, a very nice skin tightening benefit, a really nice result around the perioral rhytids. And again, this is one treatment only after 4 weeks. All right, so with that, I am going to now turn it over to Pat. And this is where I think I need to, there, oh, you got it. All right, Pat, you got it?
I've got it.
Awesome.
Thanks, buddy. Hello, everybody. My name is Pat Altavilla, and as Jamie was so kind to describe my background, yes, I think it was a nice way of saying that I'm just old. In reality, I've been in this industry for over 30 years, and it's been a privilege and an honor to participate in this industry. And it truly is a joy for me to now lead this organization to this new horizon for Suneva. So let me start by just explaining a little bit about where we sit. We look at our products and our product offering as a facial regenerative aesthetics offering. We see this as the future of aesthetic medicine. We're actually very excited about that because if you think about it, surgery, injectables, capital equipment, and medical skincare have been a part of this industry for certainly even longer than I've been in this market. But interestingly enough, there's a new horizon and it's regenerative aesthetics. And all of us at Suneva have been really excited about focusing on products that fit strategically into this category. And it's really interesting. I'm going to take you through our products that will give you a little bit better insight. But what we like about it and why we believe that Suneva is and will even more so become the leader in this space is because we actually are interested in looking at the next steps in this industry. And I think if you look at what I'm referring to, we look at the non-surgical facial enhancement today as being dermal fillers for face, neck, chest, hands, and durations are somewhere, I'll call it between 6 and maybe 24 months. Well, patients today are actually looking for longer lasting clinical outcomes. Millennials in particular are looking for longer lasting results, partly because they really are looking at the value proposition of their spend. So I'm happy to say that many of the products that we have in our portfolio are perfectly suited for the millennial market, but I'll also go and be rather bold to say that another underserved market is the male market. And I think we've actually built a very, very compelling portfolio of products to give you tools to have a complete service for your patients in your practice. So patients are gravitating from what I will call the traditional HA dermal fillers and moving to longer lasting dermal fillers, Silhouette Instalift, Dermapose, which is a really exciting new technology that we have on, which is a micro fat crafting system, all in one system. It's really quite impressive and a very elegant way to fat graft without the muss and fuss of traditional treatment methodologies. And Pure Graft, which is a method of highly purifying fat grafting. Suruglow is a handheld microdermal infusion system, and it's a lower cost procedure, a great entry point for your practices, which you'll hear about on another webinar in the future. Okay. Our surgical solutions for surgical and laser facial enhancement, taking patients from eyelid surgery, facelift procedures, PDO threads, microneedling, and CO2 lasers, and really transitioning these patients to PlasmaIQ that you've heard quite a lot about today from Brian, as well as Silhouette Instalift, which is the only PLLA, PLG lifting suture on the market, and really has been approved by the FDA for facial, for tissue repositioning. And then Amplifying is the only product that you have not heard me address. Amplifying is our PRP solution. We right now have our PRP tubes, which are quite common in the market, but we really do believe that Amplifying PRP syringe will become the game changer for PRP, a self-enclosed syringe that will facilitate easier spinning of the blood, as well as re-injecting for the patient. The third category that we really play a part in is the world of hair restoration. Both Dermapose and Amplifying are products that physicians are using today in this area as well. We're very excited about that. So let me take you kind of a little bit through the product portfolio just so that you understand. Bellafill is the product that has been our flagship brand and is really a remarkable product. It is the FDA has approved it for a 5-year treatment. And I actually say that it has tremendous benefit for the doctors because our physicians have really enjoyed the fact that it takes the handcuffs off the patient, and now they have more money, more disposable income to spend in the practice on a more routine basis. And it's really been exciting because physicians have been able to drive patients to other procedures in their practice where their ROI is quite substantial. Most physicians are charging between $800 and $1,000 per syringe for Bellafill. The retreatments are typically somewhere between 2 and 5 years, depending upon the patient, their age, when they're initially treated. But because the aging process continues and our patients are losing between around 1 cc of volume every year, we do find that patients are coming back between 1 and 2 years for at least a syringe or two to be re-injected. So it's actually a very valuable proposition for our practices. Silhouette Instalift, Suneva was blessed to be able to take on in May of 2020 as we were beginning to emerge from the pandemic, at least in the early stages. Patients typically need between 6 and 8 sutures, 3 or 4 per side. The sutures are being charged to the patient at a rate of about $500 per suture, and the patients typically are coming back every 2 years for this treatment. The duration of the product is between 18 and 24 months. PlasmaIQ, you have certainly heard a lot about that, so I won't belabor the point. Patients need up to 3 treatment cycles depending upon the depth of the line in which you are trying to treat. The average price is about $700 per treatment, And right now, the anticipation is that patients would want to undergo this treatment every 2 to 5 years. Although it is difficult, we do not have tremendous longevity yet to be able to provide you what the true duration will be on this product. Glow MD, we just launched it in Q1 of 2021. It is 2.5 ml for a full face treatment. The patients are being charged between $400 and $600 per treatment. And we really do believe that patients will have this procedure quarterly and team it up with an event that they're trying to get ready for. And the duration is probably 3 months for the treatment outcomes. On PureGraft, it's our fat grafting system. We brought that product on in Q1 of 2019. We actually, it can be used for face and body treatments. We have a 50 cc, a 250 cc bag, and an 850 cc bag. So depending upon the area that the patients are requesting be treated, it would dictate which size bag that a physician would want to use. In PureGraft, it's probably around $100 per cc. And on this slide, there is actually an error, but I did want to point out that Dermapose, which is the handheld syringe, it's a dual syringe chamber, quite an elegant way to harvest, purify, and size fat all in one system. That actually runs between $20 and $30 per cc. So it makes volumizing a patient's face far more affordable than any other treatment modality today. And I think you would really enjoy taking a look at this in the future. Excuse me. And last but not least, we do have 2 groupings of products under the PRP category. One of which we began selling in Q1 of 2019, and our second syringe is coming late in Q2. So how do we look at our portfolio? Well, we look at it that we serve 4 primary areas in a facial aesthetic practice. We create structure, we provide lift, we create volume with many of our products, and last but not least, we provide both skin and hair rejuvenation. We're very excited about our full portfolio, and over time, we hope to have an opportunity to engage even more robust of a relationship with MedResults so that we can continue to drive this. In addition, we're very, very proud, and we are very committed to both fulfilling FDA requirements. As you heard Brian say earlier, we have PMA devices, we have 510K devices that are both Class 1 and Class 2, and we secure Health Canada clearance on every one of the products that we choose to launch in that market. In addition to that, we also are an MD-SAP facility, and we have the FDA audit on an annualized basis. We're very proud of our facility and our commitment to providing safe and effective, and more importantly, cleared or approved products by the FDA. We are unrivaled, in my opinion, in both our marketing and training support. As a small company, we're actually very proud of the fact that we continue to bring really innovative programs and comprehensive training to our practices. We are here to support our practices on all levels, but training and marketing continue to be our premier feature. In addition to that, I really would love an opportunity for all of you to get to know our portfolio in a more intimate manner than certainly on this presentation alone. But I think you'll find this comprehensive portfolio of facial regenerative aesthetics products to be quite impressive. And now I'll see if you have any questions.
I just pop back in. Pat, thank you for your comments. It looks like everybody's being a little shy today on the chat box. So we didn't have any questions come in on the chat box, but I will certainly receive emails after the fact, I'm sure, from our listeners and those of you who've tuned in today. I'd like to thank you both, Pat and Brian, for joining us today. And for our MedResults customers who are on the line, again, just to kind of reiterate what I mentioned in the very beginning, which is we've had a great long-term partnership with Suneva for Bellafill, but the opportunity goes far beyond Bellafill now. And I think with the expansion of the Suneva Medical portfolio, now with 8 exciting new technologies, and of course, you guys are expanding your footprint in the regenerative product arena, MedResults members can expect to see more of that in the future. And, one of the things that really attracted us, not only to Suneva Medical, but to PlasmaIQ and some of their other technologies, is the fact that these technologies are providing treatments that are affordable for customers, affordable for patients. They are extremely effective, great technologies for rejuvenation, both of the skin and all of the other areas that Pat discussed. And I think what's important to our members, a lot of times, some of the objections we get to technology are the costs of expensive pieces of capital equipment and the time it takes to pay those devices off. And unfortunately, all of you are aware of the laser graveyard that we hear about so frequently, and certainly with COVID and the changes there, many of our members have expressed their disinterest in spending a lot of money towards expensive equipment for the fear that it won't get used. But with this, we love that these are affordable pieces of equipment. They're safe, they're effective. And not only does Suneva provide these excellent devices, they provide the training, the education, and such unique incentives to you guys as members of MedResults Network. Both on the cost of the device, which I would love to talk to any and all of you who have an interest in the PlasmaIQ, because we have an amazing special that Suneva Medical has been so generous to offer to our members. It runs through August 31st. I can tell you more about it offline. But with that, you're not only going to get the device, but you're also going to get that training, the education, and of course, the marketing that Brian had talked about very early on in the presentation. So with that, I don't know, Brian or Pat, if you have any closing comments, but I certainly appreciate the time you spent with us and with our members today. And I am looking forward to learning more about all the exciting new products that you're adding to your portfolio.
Jamie, thank you very much. We do appreciate our relationship, and we have really long treasured the friendships that we have formed with our MedResult partners. You and Jeff have been tremendous. So thank you for everything you do in partnering with us.
Of course. You guys have been wonderful partners as well. So with that, I'll close it out. And again, if anybody has questions, do feel free to contact me anytime. I'm at Jamie at MedResults Network. You've seen our communications. We frequently send out stuff about Suneva Medical and PlasmaIQ and the great opportunity that is presented by their technologies. And we look forward to seeing you at our next educational webinar presentation. So thank you all and have a great rest of your day.
Thank you. Have a wonderful day.
Take care. Bye-bye.